Swallow right now, just once. Notice what's sitting at the back of your throat, that thickness that won't clear no matter how many times you cough into your fist this morning. Maybe you've stopped even noticing you do it. It's just become part of getting up, part of your morning, part of you. Here's the thing nobody tells you, that mucus isn't random, and it isn't just getting older. Your body doesn't produce symptoms for no reason, it's responding to something specific, and once you know what, most of it is manageable. Anyway, let's get into what's actually happening, because the biology here explains almost everything else we're going to talk about. Your body makes mucus around the clock every single day, and that's completely normal. It's a protective layer for your airways, catching dust, bacteria, and viruses before they get deeper into your lungs, keeping the throat lining moist instead of raw and cracked. Mucus itself isn't the enemy. What changes is how well your body clears it. Lining your airways are millions of microscopic hair-like structures called cilia, tiny, constantly beating strands that sweep mucus upward and out, so it never has a chance to pool. In a younger adult, that sweeping happens fast enough that you never notice it working. But research on airway aging has shown that ciliary beat frequency slows down over the decades. Mucus that would have cleared in seconds at 40 can sit and thicken for hours at 65 or 70. That's not a complaint about aging, it's just physiology, and it's the reason the same trigger hits harder and lasts longer in this age group than it did when you were younger. One of the biggest reasons this gets missed is a quiet condition called laryngopharyngeal reflux, silent reflux for short. Most people know classic heartburn, that burning feeling after a heavy meal. This is different. There's no burning, no chest discomfort at all, just a throat that won't settle. Here's what's going on underneath. At the junction where your esophagus meets your stomach, there's a muscular valve whose only job is staying closed after you eat. With age, that valve can lose tone, like a rubber band stretched one too many times, and stomach acid drifts upward into the throat and voice box while you sleep. Your throat tissue isn't built to handle acid the way your esophagus is, so it responds the only way it knows how, producing thick mucus to coat and protect itself. You wake up to that heaviness and have no idea why because there was never any heartburn pointing you toward your stomach in the first place. I see this play out constantly. Someone convinced their throat has nothing to do with their stomach simply because nothing ever burns. Ask yourself honestly, is it worse first thing in the morning? Does your voice sound rougher before you've had coffee? No burning at all. Just this. Those are the fingerprints of silent reflux, not just a bad night. There's another piece here that doesn't get nearly enough attention, and it's one I think about a lot because it's so easy to miss. Certain blood pressure medications, specifically a class called ACE inhibitors, can cause this same throat irritation as a known side effect. It's not an allergy, and it's not a sign something's wrong with you. It's simply how the drug interacts with a substance in the body called bradykinin, normally broken down fairly quickly, but this class of medication slows that process down, and some people's throats are more sensitive to that buildup than others. The frustrating part is timing. This side effect can take months to show up, so if you started a blood pressure medication 8 months ago and your throat only started bothering you 6 months in, you'd probably never connect those two events on your own. If you're on one of these medications and unsure whether it's an ACE inhibitor, your pharmacist can tell you in under a minute, and there are alternative medication classes that manage blood pressure just as well without this particular effect. Then there's the sinus piece, and this one's sneaky because it doesn't look like a sinus problem at all. No pressure, no headache, nothing dramatic, just sinuses that are mildly inflamed and quietly draining down the back of your throat all day. That's post-nasal drip. A lot of people treat it with antihistamines from the pharmacy, assuming it's seasonal allergies, and then feel let down when it doesn't really help. Antihistamines dry the mucus temporarily, but they don't touch the inflammation causing the extra production in the first place. And dried, thickened mucus stuck at the back of your throat can honestly feel worse than what you started with. I keep coming back to how underrated plain saline rinsing is for this. It sounds too simple to actually work, and I used to think the same thing myself. I was wrong about that. Clinical reviews on nasal irrigation consistently describe it as a safe, low-cost way to physically clear inflammatory mucus and support that ciliary clearance system we talked about earlier. The catch is consistency. One rinse gives you one good day. Daily use over a couple of weeks is where people actually notice a difference. Something people almost never think to question is hydration, not because it's untrue, but because it sounds too basic to matter. Your mucus is mostly water, and its texture depends directly on how well hydrated your tissue is. Well hydrated, it moves easily. Dehydrated, it just clogs up and sits there. Here's the wrinkle specific to this age group. The thirst mechanism itself gets less reliable as we age. A younger adult feels thirsty well before they're meaningfully dehydrated. Past 60, that early warning system is blunted, so you can be dehydrated enough to thicken your mucus noticeably without ever feeling particularly thirsty. Waiting for thirst means you're already behind. And then there's the piece almost nobody brings up in these videos, which I think is a real gap: the connection between your gut and your airways. Your digestive tract and respiratory system share regulatory pathways through the immune system. When the balance of bacteria in your gut is disrupted, a state researchers call dysbiosis, it can trigger immune responses that promote excess mucus production in the airways, even though nothing is physically wrong with your throat. A 2022 study in the American Journal of Respiratory and Critical Care Medicine linked gut bacteria imbalances to elevated inflammation markers in the airways of older adults, part of a growing body of research on what's now called the gut-lung axis. It points to something practical: a diet low in fiber and fermented foods, along with repeated antibiotic courses over the years, can quietly shape how reactive your airways are. This isn't about anything you did wrong. Most people dealing with years of throat clearing have simply never had any of this explained to them in plain language. That's genuinely unfair, honestly. You've probably tried lozenges, extra water, throat sprays, and none of it addressed what was actually going on underneath. Before we get into what to actually do, I want to be upfront about something. Most persistent throat mucus in this age group is exactly what we've covered: manageable, not dangerous. But a few signs mean this stops being a manage it at home situation and becomes a call your doctor this week situation. Mucus with any blood in it, swallowing that's gradually getting harder, unexplained weight loss alongside the throat symptoms, a lump or swelling in your neck, or a voice change that isn't improving. If any of those apply to you, please don't sit on it. Bring it to your doctor directly. For everything else, here's where to start. Stop eating at least 3 hours before you lie down. Your stomach is still working during that window, and that's exactly when the valve we talked about has the hardest time staying shut. If you can, raise the head of your bed a few inches, using a wedge under the mattress or headboard, not extra pillows stacked under your neck, since that just bends things the wrong way. Before bed, drink a full glass of warm water to support overnight clearance. Tomorrow morning, before coffee, before anything else, drink 1 to 2 glasses of plain warm water. It starts rehydrating you and loosening what built up overnight before it becomes your whole morning. Pick up a saline rinse bottle from the pharmacy and use boiled, cooled water with a small pinch of salt. Once a day, ideally in the morning. Give it 2 full weeks before deciding whether it's helping. That's the honest timeline, not 2 days. If you're on a blood pressure medication, book an appointment specifically to review it, and bring a written timeline of when your throat symptoms started relative to when you started or changed the prescription. Add 1 small daily serving of a fermented food, plain yogurt with live cultures, kefir, a spoonful of sauerkraut, as a long-term way to support your gut. That's not an overnight fix, but it's the kind of change that actually shifts your baseline over months. A quick word on things people commonly try. Honey genuinely soothes irritated throat tissue and isn't harmful, but it won't touch any of what we discussed today. It's comfort, not treatment. Dairy doesn't create mucus out of nothing, though some people do notice their existing mucus feels thicker after dairy. If that's you, a 2 to 3 week reduction trial is a reasonable thing to try. And if silent reflux sounds like your situation, be cautious with apple cider vinegar. Adding more acid to a system that's already dealing with acid reaching the wrong places can make things worse, not better. If you remember nothing else from this video, remember that your throat has been trying to tell you something specific this whole time. Not just, you're older now. Silent reflux working quietly overnight. Post-nasal drip that never announces itself loudly. A medication side effect that shows up months after the fact and never gets connected. Dehydration running just under the level where you'd actually feel thirsty, and a gut-airway connection most people have never heard of. None of these require you to just accept constant throat clearing as your new normal. Everything in this video is for educational purposes only. Always talk to your doctor or healthcare provider before making changes to your health routine, especially around medications. If this was useful, give it a thumbs up, leave a comment with your own experience, and subscribe if you'd like more videos like this one.